Today's lecture is going to be on the appendicular skeleton. The appendicular skeleton consists of the pectoral girdle, the upper extremity, the pelvic girdle, and the lower extremity. All relevant anatomy is colored green, as you can see here. The pectoral girdle consists of the clavicle and the scapula. And note that proximally, the clavicle articulates with the sternum. And when I say something articulates with something, that means it forms a joint with something. It comes together with something. So the proximal clavicle and the sternum form the sternoclavicular joint. The distal clavicle articulates with the scapula to form the acromioclavicular joint because it articulates with the acromion of the scapula. We're going to learn more about this soon. Speaking of the scapula, the scapula has some landmarks that you should be familiar with. Looking posteriorly, you can see the acromion, and like I just mentioned, it articulates with the distal clavicle. You can see the acromion here too, right here. You also have the coracoid process. You have the subscapular fossa, and it's called the subscapular fossa because it's on the undersurface of it's underneath the anterior surface of the scapula, hence subscapula. Sub means underneath. The glenoid fossa cavity, the glenoid fossa here, right here, articulates with the head of the humerus to form the shoulder joint, otherwise known as the glenohumeral joint. And you have the spine of the scapula here. The humerus consists of the head, which is right here, and there's a surgical neck. There's also an anatomical neck, but the surgical neck is more clinically relevant because I find that that's the one that gets fractured more often. So hence it's more clinically relevant because that's the part that's more likely to be broken between the two necks. You have the shaft, and you have the medial and the lateral epicondyles. You have the olecranon fossa, which articulates with the olecranon of the ulna to form the elbow joint. Speaking of the joints, we have the shoulder joint, which is the glenohumeral joint. It's formed by the glenoid fossa of the scapula and the head of the humerus. It is a ball and socket joint. The elbow joint, as I mentioned about a minute ago, is formed by the olecranon fossa of the humerus and the olecranon of the ulna. It's basically where the humerus and ulna articulate. So the olecranon fossa here, the olecranon of the ulna here. And it is a hinge joint. You can see it hinging. It's hinging. Now let's talk about the radius and ulna, the two bones of the forearm. The radius has the styloid process, which points towards the thumb, which is otherwise known as the first digit. And the radius at the level of the wrist is located on the thumb side. The ulna, as I mentioned already, has the olecranon, which articulates with the olecranon fossa of the humerus. And in the wrist, it's located on the pinky side of the forearm. The pinky finger is also known as the fifth digit. Let's talk about the bones of the wrist and the hand. Now, as I just mentioned, note the relationship of the radius and ulna. They articulate with the carpal bones to form the wrist joint. So you got your radius here, and as I already mentioned, the styloid process of the radius points towards the thumb. The ulna is on the fifth digit side of the wrist. Now, when it comes to the carpal bones itself, I wouldn't require you to know the individual bones unless you plan to become a hand surgeon or your professor tells you to do it. However, if you did have to know it, I have a nice little mnemonic called scared lovers try positions that they can't handle. Anyway, I didn't come up with that, so don't look at me. Now the phalanges, actually before we talk about phalanges, let's talk about the metacarpals. So the metacarpal bones are numbered 1 through 5, with number 1 being the thumb and number 5 being the pinky finger. So you got your first, second, third, fourth, fifth metacarpal. And it's kind of nice of them that they even wrote the numbers down for you. And then we have the phalanges, which are named similarly to the metacarpals. We have the proximal phalanges, we have the middle phalanges, and we have the distal phalanges. Note that the first digit, the thumb, does not have a middle phalanx. So you got your first digit, you got your proximal phalanx, distal phalanx. You got your proximal, middle, distal phalanx. Now let's look at the pelvis, i.e. the pelvic girdle, and recall that it consists of the ilium, ischium, and pubis. The ilium is right about here, the ischium is about here, and the pubis is right here. Some noteworthy landmarks are the anterior superior iliac spine, which you can find here. You have your superior and your inferior pubic rami. You have your pubic symphysis. It's called the pubic symphysis because symphysis means coming together, and the pubis on each side comes together. You have the acetabulum, which articulates with the head of the femur to form the hip joint. So this is the acetabulum right here. And also recall that the pelvis articulates with the sacrum to form the sacroiliac joints. So I have the pelvis here articulating with the sacrum right here at the sacroiliac joint. Also on this side as well. Let's talk about the hip joint. The hip joint is formed by the acetabulum of the hip and the head of the femur, also known as the acetabulo-femoral joint, if you want to get real geeky up in here. So anyway, it's a ball and socket joint that's similar to the shoulder joint. So right here you got the head of the femur moving within the acetabulum. Now let's talk about the femur. You have the head of the femur, which, as I already mentioned, articulates with the acetabulum to form the hip joint. You have your neck. You have your greater trochanter and your lesser trochanter. You have the shaft, just like every long bone has. You have your medial condyles and your lateral condyles. Now these condyles, they articulate with the tibial plateau to form the knee joint. And as I just mentioned, the knee joint is formed by the femoral condyles and the tibial plateau, as well as the patella. Basically what I'm trying to say is that the knee joint is where the femur and the tibia come together, with the patella as a little icing on the cake. So you got your femoral condyles, you got your tibial plateau, and you got your patella. And as you can see here, it's a hinge joint that's similar to the elbow. Now let's talk about the tibia and fibula. In the leg being the portion of the lower extremity below the knee, the tibia is the weight-bearing bone. You can see how it's thicker here. So clinically, if you have a fracture in this bone right here, the tibia, it generally needs to be surgically repaired. The fibula is a thinner bone, and it does not contribute significantly to weight bearing. I think it only contributes about 15% to weight bearing. So clinically, an isolated fracture of this bone typically does not need to be surgically repaired, and basically you can just reduce it and treat it with a cast. Let's talk about the foot and ankle, the tarsal bones. The notable ones are the talus, and that's because it articulates with the tibia and the fibula to form the ankle joint. You have the calcaneus, which is known as your heel bone. You have your metatarsals, and similar to the metacarpals, the metatarsals are numbered 1 through 5. 1, 2, 3, 4, 5. And it's pretty nice that they wrote these numbers on the bones for you. Number 1 is the big toe, also known as the hallux, and number 5 is the pinky toe. Not finger, toe. And then we have phalanges, just like we have in the hands. And similarly, we have the proximal, middle, and distal phalanx. And just like in the hand, the first digit, which is the big toe, which is the hallux, only has a proximal and distal phalanx. There's no middle phalanx. But the rest of the toes have a proximal, middle, and distal phalanx. That's all, folks. It looks like we're done. Like this video, subscribe. Thank you.